Let us now learn some previous year questions. The first question is in medicine, non-exertional. First question, non-exertional classical heat stroke is or are predisposed in. Non-exertional classical heat stroke is predisposed in heat stroke. So it is predisposed in persons with previous chronic ill patients, true, and healthy patients. So non-exertional classical heat syndrome is predisposed in elderly and in chronic ill patients. Second question, features of Parkinsonism are, they are rigidity, hypokinesia, and rest tremors are the features of Parkinsonism, whereas dementia is present in Alzheimer's disease, not in Parkinsonism. Next question, which of the following are the causes of motor neuropathy? Motor neuropathy are Guillain-Barré syndrome, diphtheria, diabetes, and Friedreich's ataxia. All these are motor neuropathies. So Guillain-Barré syndrome, diabetes, diphtheria, and Friedreich's ataxia are all motor neuropathies. Diabetes is also a sensory neuropathy also. Which of the following are the features of pre-renal acute renal failure in compared to intrinsic renal failure? Acute renal failure, you will see presence of fractional excretion of sodium less than 1, urine osmolarity more than 500 milliosmoles per kg per liter, urine creatinine to plasma creatinine is more than 40, it is also true. Blood urea nitrogen is to creatinine ratio, this is more than 20 actually, and renal failure index is less than 1. Renal failure index is less than 1. So these are the points in favor of pre-renal acute renal failure. Then next question, drugs causing pulmonary fibrosis are, pulmonary fibrosis is caused by amiodarone, gold, and bleomycin. Amiodarone, gold, and bleomycin will cause pulmonary fibrosis, are the drugs which cause pulmonary fibrosis. Then next question, which of the following causes hyperkalemia? Hyperkalemia is caused by tumor lysis syndrome because of the breakage of the tumors. Barter's syndrome, actually it causes hypokalemia because it causes loss of potassium in the urine. Even renal tubular acidosis also presents with hypokalemia. Even both renal tubular acidosis will present with hypokalemia. Addison's disease also has hyperkalemia because in Addison's disease there is aldosterone insufficiency. So as a result the potassium cannot get excreted. Okay. Next question. Treatment of hyperkalemia is treated by insulin. You can treat it by hemodialysis, beta agonist, and also along with insulin you can give dextrose insulin and you can treat hyperkalemia. Insulin helps in, see how does insulin help? Insulin causes potassium to uptake by the cells. As a result the potassium which is present in the blood will decrease. Okay. Then next question, which of the following is true regarding diabetic ketoacidosis? True statements about diabetic ketoacidosis. Diabetic ketoacidosis, the fluid deficit in most of the patients is often not 5 to 4 to 5, not 5 to 10, it is 4 to 5 liters. Fluid deficit in most of the patients is 4 to 5 liters. pH will be actually less, it is ketoacidosis, so it will be less than 7.30, that is 7.25 to 7.30, it will be between it, or it can be even less than 7.2 also, it can be 7.2 to 7 to 7.2, or it can be less than 7. Actually we will classify this diabetic ketoacidosis into these three types. Less than 7 is severe type, 7 to 7.2 it is moderate type, 7.24 because 5 is here, no. 7.24 is moderate type and 7.25 to 7.30 is mild type. Then next question, hypokalemia initially present, do not administer insulin until the potassium is corrected. True, we do not administer insulin until the potassium is corrected, because this potassium will cause correction of insulin will be used in correction of potassium. So first and foremost we will have to correct the potassium and then we can correct the insulin. Ketosis, obviously in diabetic ketoacidosis you will see ketosis. And bicarbonate should be given in all cases. No, it is only given if there is bicarbonate deficit is present, or else we do not give bicarbonate in all the cases. Then next question, which of the following is true is not true regarding anorexia nervosa? Anorexia nervosa is the people who do strict dieting. There is amenorrhea is present in them and distortion of body image and endocrine abnormalities are seen. Hallucinations are not seen in anorexia nervosa. Next question, which of the following are true about inflammatory bowel disease? Smoking decreases the risk of Crohn's disease and increases the risk of ulcerative colitis. Actually it is different. Smoking increases the risk of Crohn's disease and it decreases the risk of ulcerative colitis. P. Anca is associated with ulcerative colitis. It is true. Linear ulcers are seen in Crohn's disease. Yes. Pseudopolyps are seen in ulcerative colitis. Cobblestoning is seen in Crohn's disease. Next question, true about pulmonary embolism. Most common presentation for pulmonary embolism is asymptomatic. True. Systemic hypertension usually occurs. No, there is no relationship between pulmonary embolism and systemic hypertension. S1Q3T3 is sign on ECG. Yes, but most common sign on ECG is normal. There will be sinus tachycardia is the most common sign which you see in ECG. But S1Q3T3 is also seen in ECG. Dyspnea is the most common symptom. Yes, and patients will have cardiovascular collapse because of this embolism, because this will go and block the pulmonary arteries. Next question, right, which of the following causes acute pancreatitis? Gallstones, most common cause of acute pancreatitis. Hypertriglyceridemia causes acute pancreatitis. Stavudine, actually stavudine, this will not cause acute pancreatitis. Steroids and hypercalcemia will cause acute pancreatitis. Right. Next question. Then paradoxical, please refer about this stavudine. I am a little confused about this. Next, paradoxical and reverse splitting of second heart sound is seen in, that is normally heart sound should be A2 followed by P2. But if it is P2 followed by A2, then we call it as reverse splitting of second heart sound. This reverse splitting of second heart sound is seen in. So, for aortic stenosis, it will take lot amount of time for the blood in the left ventricle to go through the stenosed aortic valve. So, reverse splitting is seen in aortic stenosis, and if there is complete left bundle branch block, so because of left bundle branch block, the impulses cannot travel to the left side of the heart. So, left ventricle does not reach the impulses. So, as a result, P2 occur earlier than A2. Next question. Herpes encephalitis findings are, herpes encephalitis most commonly involves frontal and temporal lobe. It most commonly involves frontal and temporal lobes, not the basal ganglia. Hyperintense lesion is seen in T1 Wade lesion of temporal lobe. Actually, hyperintense lesion will be seen, but it is not in T1. it is in T2 lobe. It is seen in T2 lobe. So herpes simplex, it is seen in frontal and temporal lobe. It is commonly seen in basal ganglia. No. Hyperintense lesions are seen in T2 weighted images. So D statement is true. Hyperintense lesion of encephalitis is seen in T2 weight images. The next question. Okay, which of the following included in ATP3 criteria of for metabolic syndrome? Metabolic syndrome, in ATP3 criteria we have BP more than or equal to 130/85, triglycerides more than or equal to 150 milligrams per deciliter, and also fasting glucose more than 100 milligram per deciliter, and waist circumference will not be present in this ATP3 criteria for metabolic syndrome. The next question. Which of the following is true about pneumothorax? In pneumothorax, you will see that there is decreased chest movements. It is not dull. It is resonant on percussion. Pneumothorax will be resonant on percussion. You will see decreased breathing sounds. You will see hyper resonant on percussion, and expiratory crepitations will not be there. So there is decreased chest movements, decreased breath sounds, and hyper resonant on percussion is seen in pneumothorax. Then person's chest X-ray showing homogeneous opacity on the right side with shifting of mediastinum to the opposite side. What is the diagnosis? See, mediastinum is shifted to the opposite side like this, and there is an opacity. It is in right side. I do see think that this is right side. So this is homogeneous opacity with shift to the left. It is homogeneous, so it is pleural effusion, and there is shift to the left. Even the pneumothorax will also have shift to the left with shifting of mediastinum to the opposite side is also seen in pneumothorax. But the difference is, in pneumothorax you won't see it has an opacity. You will see it has dark shadow. Darkness will be seen. Right? Next question. Next question. Paraneoplastic syndromes of lung carcinoma include. In the lung carcinoma, it includes hypercalcemia, SIADH, and it includes hypocalcemia also. This hypocalcemia is because the lung cancer produces calcitonin, and hypercalcemia is because the lung carcinoma produces parathyroid hormone releasing related peptide. Right? Next question. Which of the following investigations are useful for Zollinger-Ellison syndrome or gastrinoma? Octreoscan. For Zollinger-Ellison syndrome, octreoscan is actually the best investigation. Along with that, USG, CT, MRI, and even endoscopic ultrasonography are also useful for this Zollinger-Ellison syndrome or gastrinoma. Next question. The community acquired pneumonia is caused by. Community acquired pneumonia is caused by Staphylococcus, Mycoplasma pneumonia, Streptococcus, and influenza. Community acquired pneumonia is caused by Staphylococcus aureus, Mycoplasma pneumonia, and Streptococcus pneumonia. Next question. Treatment of faciocervical actinomycosis is. Actinomycosis, you can give penicillin G as drug of choice, and even amoxicillin can be used for treating faciocervical actinomycosis, penicillin G and amoxicillin. Next question. Neoplastic lesion in AIDS include. In AIDS there can be non-Hodgkin's lymphoma can occur. Even anal carcinoma can also occur in AIDS. Other cancers like Kaposi sarcoma, primary lymphoma of brain, and invasive cervical carcinoma can also occur in AIDS defining malignancies. Others like even multiple myeloma, cervical, brain, testicular, oral, lung, gastric, liver, renal, and anal carcinomas can also occur. True regarding CPR. CPR, compression to ventilation ratio is 15:2 in adults. No, it is in children. Then compression to ventilation ratio is 30:2 in adults. This is true. End tidal carbon dioxide is more than 20 is an effective sign of CPR. This is true. Right? Next question. This is false, obviously. Sequence is not CBA, it is A, B, C is the sequence. So this is about the important questions in medicine. Thank you for watching.